Hello, everyone. Russell Gaynor is joining us with a presentation on COVID-19 and caregiving. Russell is a healthcare professional with many years of experience in various settings. His professional experience includes working with crisis hotlines as an adult probation officer, a DWI education instructor, as an adult, adolescent, and children's psychiatric hospital counselor with over 18 years in hospice, an adjunct professor teaching sociology and psychology, a private psychotherapy practitioner, and a national hospice consultant, a hypnosis and guided imagery instructor, as well as a professional geriatric care manager. He is also an active member with the American Cancer Society, the Alzheimer's Association, and is a past president of the Funeral Consumers Alliance of San Antonio. Thank you for being here with us, Russell.
Thanks, Riley. Good to join you today.
Good to join you as well.
So the Alzheimer's Association reached out and asked me to talk a little bit about caregiving and COVID and some of what we're seeing now. And so part of the presentation is going to look, make sure I can move there. We're going to be looking at COVID-19 and dementia, specifically what are some of the risks and things that we need to be mindful of. We'll be looking at some of the tips for caregivers, ways that we can take care of ourselves as caregivers, and also look at some of the issues that come up with facility navigation and facility management for the resident that has dementia. We'll also be looking at some of the resources that are available from the Alzheimer's Association. So what's interesting is with the outbreak of COVID-19, we've not had experience working with this kind of a pandemic before. So it really has made a lot of the industry and healthcare really challenged to try to figure out what's the best way to navigate this, to keep the patients safe, the staff safe, and the families with access to that patient. So some of the things that we are being able to determine is that it does not seem that dementia by itself increases risk for COVID-19. So just by the fact that the person has dementia or that disease of dementia does not seem to be an indicator that COVID-19 is going to be any worse for that person. However, there are some things that we do need to be mindful of and look at. Specifically, because of the dementia-related behaviors, the increased age and common health conditions that frequently accompany the person with dementia, there may be more risk associated just because of those comorbid situations. For example, a person living with dementia may forget to wash their hands or take other recommended precautions to prevent illness. So because of the dementia's forgetfulness, they do seem to have a more increased risk. We also see that COVID-19 may worsen cognitive impairment due to dementia, just like some of the other flus as well. So it's not just COVID-19, it's flus in general seem to make this more risky. On the Alzheimer's Association website, there's a tip sheet and a topic sheet for this presentation and associated information. So I know that Jenny and Diane will be happy to make these available for you, either in the chat box, you can ask for that, or you can go to the website and look for these pieces of information. But they're very helpful, and they look at things like tips for caregivers with taking care of someone with dementia at home. What are some of the things for caregivers who are taking care of a person in an assisted living facility or home-based services? What kinds of things do we need to be mindful of there? And if you have a loved one that's going to a residential facility, there's a good list of questions that you can ask there. We'll actually go through some of these in just a few minutes. So there are a few things that we want to look at when we talk about the caregiver who is taking care of a person at home. So individuals living with dementia need a lot more support. Because of the memory issues, we have to make sure that we frequently remind them for some of the behaviors that are likely to put them more at risk. So If you have a place that they wash their hands frequently, it might be useful to put a sign up that says, remember, wash your hands for 20 seconds before rinsing. That might be a way of prompting or cueing them to be able to engage successfully in that behavior. The other thing would be is to demonstrate what good hand washing looks like. It's one thing to tell somebody to go wash your hands, but if they can't remember exactly how good of a job to do, it might be useful to demonstrate that for them. I know one technique that I've seen people use is to sing the happy birthday song 2 times. And that seems to be about the right length of time to engage in that hand washing. So you could come up with some little ideas like that that might help that person remember to do good hand washing and doing a complete job with that. If there is not hand washing facilities available wherever you are, then we do recommend that the use of hand sanitizer is something that can be applied to help reduce the risk. A good hand sanitizer is one that has at least 60% of alcohol. So again, it's a good alternative in case you're not able to get to a sink and wash those hands. So let's look at more about the caregiver working at home. You know, one of the things as a clinical social worker that's been associated with people taking care of dementia patients that I've seen, we really have to be mindful of watching for sudden changes in mentation. So if there's a dramatic change from one day to the next of the degree of confusion, maybe it's word searching, maybe it's orientation. If that's something that occurs, then we really need to make sure we contact the healthcare provider. So if there's a home health nurse involved, or even sending a nurse at the doctor's office, a message to them just to say, hey, there's something going on. Sometimes that might be an indicator that there's a UTI or some other infection going on, and that's a good early warning sign that we need to be mindful and take proactive steps. One of the other things, and I thought this was a great tip, because we're trying to make sure that we reduce exposure to the possibility of having COVID enter our environment. If you have a prescription that is filled regularly, you might see about getting a bigger amount of that prescription ordered. So instead of just a 2-week supply or a 30-day supply, consider getting a 90-day supply. That way we don't have as many trips to the pharmacy, or if it's a home delivery, we don't have that many exposures coming into the home. Also, try to make alternatives if you have adult daycare available to you, or if there's somebody that's helping to provide respite. Think about what happens if that facility is not available, or if the person that's providing the respite care for you is not available, what to do as a backup. This is one of the things that's really important for us as caregivers, is to make sure that we're taking good care of ourselves, and use of these kinds of resources of ways that we can do that. So we want to look at what happens if that person is not available, or that facility is not available. And also, this was an interesting experience that I had personally. I was working with a client. I went into his home, and he started having a lot of respiratory issues and asked to be taken to the hospital. And at that moment, kind of alarm bells went off in my head, and I thought, my goodness, maybe he has COVID actively, and I've just been exposed. So after I finished the visit, I called my wife and I said, hey, this is the situation. What do you think we ought to do? After a few minutes of dialogue, we decided, it's probably best if we act as if I had an exposure. So when I came home, I sequestered myself to the back part of the house. After a bit of dialogue, my wife decided, I think I'm going to go over to her mom's house because that was what was more comfortable for her. And that way we didn't have to worry about her being exposed, because I was as well. But as we navigated that, it became really poignant, because we looked at each other standing 12 feet apart with our masks on going, is this the last chance we have to see one another? It really was a way to bring the significance and seriousness of this issue at home. Because before then, we kind of talked about what would happen if one of us got an exposure, but we hadn't really thought through all the small steps. So if you're the caregiver of a person with dementia in home, think about that, about the specifics of what we would do if there is an exposure in their home. Is there an alternative plan, and exactly what steps would it take to execute that? Having that available really helped us as we kind of walked through that situation. It ended up that it was a false alarm, which we were both grateful for, but just the exercise in and of itself was valuable for us. So some of the things that we can look at if you have an individual in a facility. So we want to check with that facility regarding what their procedures for managing COVID-19 risks. A lot of facilities are doing temperature measurements before allowing anybody entry into the facility. Masks have to be worn. One of the facilities that I visit as a professional requires that you wash your hands before moving on to inside the facility. And they have it all set up so that happens. But asking that facility what those procedures are to help mitigate the risk of someone from the outside bringing it into that facility. Also, who are the emergency contacts? If there is a problem, maybe the main phone line isn't going to be available. Is there an alternative phone number that you could use to contact somebody at the facility to get information? Also, of course, this sounds very common sense, but if you yourself are experiencing symptoms of fever, loss of olfactory senses, not being able to smell things, any of the COVID signs, certainly don't go into a facility. Take the precautions and stay at home until those symptoms resolve. And if you are unable to visit the facility because they are in a quarantine or lockdown situation, it's good to ask, how then do I have access to the loved one that's in the facility? So sometimes I will see facilities that designate a specific person to being that person to contact to set up times for phone calls, or some facilities will have a dedicated laptop or tablet that has video interface on it. And so that's the person that I have to contact to schedule time for them. So find out who that contacted person is so that we can stay in touch with them to maybe get on a schedule so that we can talk with our person that is in that facility. A couple of other things to look at when we have somebody in the facility. Now, it's important to know that we're in kind of the middle phases of this right now, and we're still trying to figure out the best ways to navigate this for everybody. And it certainly is making it very challenging. I know a lot of families who are looking at having to place a loved one in a facility because of dementia, and they're afraid that if they put them in, they'll never see them again or never be allowed to see them. So there's a lot of things that we need to think about. And it's difficult, but it absolutely is for the safety of not just the loved one that has dementia, the patients, but the caregivers as well, and the staff in that community. So here are some things that we can think about. Ask the facility what their quarantine procedures are. Some facilities are very rigid and says absolutely no one except nursing personnel in and out of their facility from other agencies. Some facilities say we're going to allow only essential personnel, and that usually does not include families. And perhaps sometimes they say, well, what about, services like podiatry? Are they allowed to come in? So finding out what that facility's arrangements are and their procedures are helpful. One of the assisted living communities that I frequent, if a resident of that community leaves for any reason, even if it's to go to a doctor appointment, when they return to their room, they're on an automatic 14-day quarantine. So some of the facilities have practices like that make it challenging for the residents themselves and for the family members, because they become very calculating about how they're planning their trips out of that facility. You can ask the facility what their level of confidence that the CDC guidelines are being followed. Just as a way of either talking with the administrator or one of the nurse managers, and just say, hey, help me understand what you are seeing inside your own community, and what level of confidence do you have that you believe that these guidelines are in place. Another good question is, how many in the facility have been impacted by COVID-19? And is it staff, is it residents, or is it both? We've seen a couple of situations here in San Antonio where there have been outbreaks in either nursing homes or assisted living communities, even a memory care facility in town, that dramatically changed the way that they are able to operate and function because COVID somehow entered into that building. So we want to ask the questions about how many people in the facility have been impacted by it. And what about the resident that has dementia? Are they able to follow social distancing procedures with or without help? For example, most facilities have a common dining area. So one of the precautions that I've seen implemented is the facility will say, great, we're going to distance our tables at least 6 to 10 feet apart and limit the number of residents per table. And then they have to eat in shifts. So there's a lot of accommodations that are being made in these communities, and it's helpful to understand how social distancing looks in that community. And those are great questions to have asked. And then another good question, and this used to be an issue more so at the beginning of the pandemic, not so much now because most facilities have good supply lines, but what personal protective equipment is available to the staff from these facilities? And how often are they able to get fresh equipment if they need it? And then another good example would be how many staff members interact with that family member on a regular basis. Is the facility able to limit exposures of new people on a regular basis in that community? So these are things that as a family member, I want to know from the facility to help take care of the loved one that I've placed there. And what would happen if the facility had an outbreak amongst their staff? What's plan B to maintain adequate staffing for the level of care required for the residents? So these are questions that, again, in this uncertain time, we've not really had the chance to really think through until now. But as you are looking at facilities, these are some things that you can do to help make sure you have the confidence that the place that you are selecting to put your family member has thought through some of these issues as well. So what happens if you have to move to a different facility? Well, this makes it challenging for sure. Again, there's just no simple answers or way to completely eliminate risk for these issues. But by asking some of the questions, we at least get people to talk about their thoughts, and you can kind of tell how well they've thought through some of the issues. So there's no way to know whether a new facility is going to remain free of COVID-19 cases. We just simply have to say, what's our best guess of how they're doing it? So first, is the facility accepting new residences? Like we saw in the video during the intermission, Arden Courts, one of the facilities that I've worked closely with during this time as well, seems to have a lot of good practices in place for you to be able to virtually tour the facility, to get information about what's going on inside and what their practices are. And a lot of the same questions that we just looked at on the previous slide are going to be very helpful in helping to navigate that. So maintaining the staffing, what their procedures are, what they're going to do in an emergency are all automatic questions that we want to be able to get information from these agencies to help us feel more confident about the choices that we're making. So, residential facility incidence considerations. If we are moving person from a facility into our home, or perhaps maybe from mom's home, and it's time for her to come live with us, what kinds of questions do we need to be considering because of COVID especially? So probably one of the first questions is, what's the level of care needed on a day-to-day basis? Is it very minor and minimal? Is the person able to function pretty independently? Or do they have continence issues or wandering issues that are going to be presenting challenges of its own that we need to help plan and navigate as we bring them into this new environment? Is the family able to meet the care needs? This one of the things that I think happens frequently that I see in the support groups that I do is family members think that, oh, I can do this all on my own. But after just a couple of days or a couple of weeks, they begin to get overwhelmed because of the unending task that it takes to provide care for a person with dementia, especially in the middle, moderate stages or towards the end stages. So we really need to be mindful of planning for this. And I saw some comments on the chat before about Dr. Rabin's book, The 36-Hour Day, which I think is a great example of looking at some of the issues that come up in the home care environment. We also need to see how many people are going to be needed to provide adequate care, and how can we limit that but yet still have an appropriate amount of time to be able to meet that resident or that family member's need. And then, are any of those caregivers or the people that are going to be helping to provide care, do they have COVID-19 or do they have any possible symptoms? And if so, then what's plan B? There's nothing like, coming up with a good solid plan and saying, great, we've got coverage for all of these people, but if somebody is taken out of that assignment, then do we have backup plan for that? Are there going to be any individuals working outside of the home, maybe a home health company or a hospice company that's going to be coming in? What are their precautions? What are their procedures for mitigating COVID-19 risk, exposure to themselves and transmission into my environment as well? And will you need to hire additional help? And so if you are, then you have to look at some of the agencies that are available for caregiving and ask these same questions of them. What are they doing to mitigate this risk? What happens if the caregiver that's assigned is unavailable? How do I make sure that we have good backup plan? So this is, these are some of the questions that we need to be mindful of if we're bringing the person into a home environment that we need to start planning for as well. So in the home, one of the things that happens a lot is the caregiver gets very challenged because it's kind of like having a toddler or a young person in the home, and they want to be entertained, they want to be active. And how do we keep that environment in the home stimulated to be able to keep them engaged in the situation? Again, if you go to the Alzheimer's website on their org/care section, there are some planning tips for activities that you can download or look at yourself. And these have some really good ideas on them as well. So it is useful if you plan ahead and put a calendar together and think that on certain days we're going to have certain activities. And this can be useful, especially if you're having other people come in for care, to know that, great, while this person's here and they're engaged in an activity with the person with dementia, maybe that gives me as the caregiver a 10-15 minute break or maybe a little longer break. So that's a great idea, is to put it on a calendar, come up with a list of activities, and then schedule them throughout the week so that there's some ideas. Now, what's important on putting an activity list together, it's not so much about the person being able to complete the activity as it is the enjoyment. This is not something that we're going to put together a puzzle and we want to make sure that the puzzle is completed. We want to say, you know what, what's important is that we are engaged in problem solving and maybe sorting of the puzzle pieces. It's not so much about whether we actually get the task of completing the puzzle completed. It's more about being able to have that entertainment value. And then be mindful of the environment. One of the things that we know happens frequently, especially with both caregivers and the person with dementia, is that exposure to a lot of TV, especially the news, or sometimes social media, if that's an outlet that they use for getting information. A lot of the news and the social media sites tend to be overwhelming for a lot of us, just professionals and the caregivers and the persons with dementia. And so too much of a diet of the news that's always talking about the negative and how hard this is and all the bad things that are going on really does have an emotional impact on the person with dementia. They're very sensitive to those kinds of things and pick up on it even if they can't quite understand it. The tone of it and the intensity can be very difficult for them to distance themselves from. But we as caregivers are exposed to the same type of stimulus, really can have a negative impact on our mental health and well-being as well. So, and I know for me, watching some of the news in the morning gets really hard because of the intensity of what's going on. And as soon as I turn the TV off, it's like, oh, wow, that was nice. I didn't realize I had been kind of gotten stuck into this little loop of my own miasma of being focused on all that was going on. So turn the TV off, turn the social media off, put some good music on that is uplifting, that makes you want to dance and move. Do something that gets you out of that intensity from the news and stuff like that. And also, if you are watching TV shows, make sure that it's not something that's likely to be emotionally intense for the person with dementia. Sometimes watching some of the dramas can be a little much, and we recognize that there might be behavior patterns after, or behavior changes after a lot of watching those kinds of things. So those are the things that we can do looking at the activities as well when we get the person at home. Probably one of the things that really is a motivator for me in working with caregivers is managing caregiver stress. I was drawn into my work with the Alzheimer's Association because of the statistic that 60% of caregivers are likely to die before the patient. And that was so impactful for me. I thought, that is such a sad statistic because it's fixable, because we can do something about that. It's just a matter of helping to educate people to be alert to what the signs of stress are and to be able to put in place good plans for taking care of ourselves and having a break. So on the screen, you see some of the symptoms of caregiver stress. And I think the first one is the denial. When people say, I'm not stressed at all. And yet they find that they're forgetful, or they have trouble multitasking, or they feel overwhelmed and aren't able to manage the tasks at hand. Those are some of the things that would tell us that, well, despite your denial of saying you don't have a problem, there really are things that we need to be concerned about. One of the other things that frequently happens for caregivers is because of the intensity of the situation, the feeling of being overwhelmed and the stresses of being a caregiver, sometimes they react in ways to the patient with the person with dementia in ways that are less than kind. or in ways that I'm not happy with myself. And so I might, as a caregiver, do something or shout or be short with somebody in a way that is not at my best. And that's a good indicator there. If you find that you're engaging in behaviors that you regret or that you, excuse me, if we engage, so sorry. So being able to manage those behaviors is going to be really important. I'm going to have to take just a break, sorry. Okay. Sorry about that. Along with those behaviors, you might see that there's social withdrawal. This happens frequently with the caregivers, is not being able to stay in touch with those friends or families, those support systems that give me meaning and help me stay connected to my community. So that social withdrawal can be a part of it. Anxiety, depression, exhaustion, those are all things that we have to be mindful of, and watching our own internal gauge as to how the stress of being a caregiver are impacting us. And what's fascinating to me is when the role of caregiver is interrupted by sleep deprivation. Maybe the person with dementia had an episode of incontinence in the middle of the night, or maybe they're starting to do some wandering. Something that interrupts my ability to sleep through the night and get my rest. It really doesn't take more than 1 or 2 bad nights before suddenly we are really challenged by sleep deprivation to do a good job. And that's when you might see things like irritability or that anger come out. Some of the other signs of stress that we've talked about already, the lack of concentration or even health problems. Not being able to attend our own physician or doctor appointments is a very common thing that I see in caregivers. So if we are caring for someone with dementia, we want to be mindful of those signs of caregiver stress that can give us the indication that, you know what, maybe I need to do something different in taking care of myself so that I can be available to the person with dementia. The Alzheimer's Association has an excellent website. We're looking at the 24/7 helpline. It's a free service. There's no cost at all. It's available around the clock, 365 days a year. The helpline specialists and master level condition clinicians offer confidential support and information. They also have bilingual services available and translation into over 200 languages. So it's really an excellent way of starting to get information and support for ourselves. And if you're just having one of those bad days and you find it's 3 o'clock in the morning and you can't handle another episode of wandering, you can pick up the phone and there's somebody that's going to be there to talk through that situation as well. So the helpline is always an excellent resource. There are a couple of virtual programs. These are pre-recorded things that are on the Alzheimer's Association's website. A lot of the e-learnings. There's 10 warning signs, understanding Alzheimer's and dementia, having dementia conversations. So this is a great one for families who are saying, gosh, there may be several siblings and they're looking at caring for a parent, and it's a way of helping to engage the whole family in looking at the issues that are going to be involved in being caregivers. Looking at effective communication and strategies, financial and legal planning, and understanding and responding to dementia-related behaviors, which is really, really challenging for some families. And there's a lot more. So if you've not had the opportunity to go to the website, would encourage you to take the chance to go and look at the resources that are available there. There's also a community resource finder. You can look at programs and events if you wanted to find out where support groups are available. And I know right now during COVID, We do not have a lot of support groups that are able to meet face to face. So with the Alzheimer's Association, I've been facilitating the caregiver support groups online. So just in a format like this, except where the participants are able to see one another and we can dialogue together. The support groups are available online. So you can go to programs and events and find those resources in your community. If you're looking for care at home or community service, or even facility or residential placement options, those are available in the Community Resource Finder as well. There's also the Alz Connected. This is another place for caregivers to come together and share information and tips to talk about what's going on, what's worked, what doesn't work, and how they can do better in their role as caregivers. And lastly, the Alzheimer's Navigator, which asks us a bunch of questions about these topics, helps to get you thinking about what you might be needing, say, for the issue of driving, which a lot of families struggle with. They've got a person in their family that has dementia and that person is still driving. And how do we approach this? So by going to this navigator and clicking on that topic that is of interest to you, it asks some questions to help get an idea of what the needs are and what your level of understanding about that issue is. And then it gives recommendations and suggestions based on the input that you've provided. So the navigator is really useful for this as well. So at this point, Riley, I'm going to ask you to jump back in, see if there are any questions that may have been thrown at us while we were talking here, and see if there's anything else that I may have missed or that we want to look at a little more. Well, I'm going to see if there are any questions here. Yeah, the caregiver support group is 11 o'clock every Tuesday, and Jenny's posted the way to register for that in the chat section.
Russell, this is Jenny. Thank you so much for all of the information and also for sharing some of the experiences that you have had in your professional life with just caregivers and COVID, and just wondered if there were any other stories that you would like to share. I know that when we have support group every week, caregivers, there's just so many different things that people are struggling with as far as, like you said, being at home 24/7, really having to learn to not just be caregiver, but activity director and, everything else. So just any other stories or tips that you have.
Yeah, that's a great suggestion, Jenny. I think the thing that hurts my heart the most is watching caregivers who are isolated and alone trying to take care of somebody with dementia by themselves, and they have no support from the outside at all. This is not something that can be done by one person. And so it doesn't make sense for us as caregivers to put that Superman shirt on and say, I have this, I can manage it all. Because yes, you may be able to do it for a brief period of time, but in the long run, it does take a village, it takes a community of people. And so I encourage caregivers to put together a calendar, and on that calendar, make one day a week, maybe it's a day or an evening a week, that they have off, and one weekend where they have off. So if there are other siblings or other family members, share that calendar and say, hey, these are the days that I schedule time off because I'm the primary caregiver, and I'd like for you guys as my family to step in and put your name on this list and be a part of the caregiving role. Also, we see a lot of families who may have a church community or another social group that they have been a part of, and that community or other social group says, if there's anything we can do, let us know. And caregivers often at the time just don't know what to think about that. So the best thing to do is, I say grab a stack of Post-it notes And when you are at home saying, gosh, I haven't been able to change the security light outside, there's the toilet in the back that's running, maybe mowing the yard once a week, or I've got a doctor appointment for myself, and it would be helpful to have somebody write those things on the Post-it notes, put them on the fridge, and when somebody,
yes.
if there's something I can do to help, you've got a place to go that has that information that you've written down in advance. So what I've told people to do is go to the refrigerator, look at the little Post-it tabs, and if you see something that speaks to you, take that, and that's your task, and that's the best way to help.
Oh, I love that idea. Even just things like, can you drop off a gallon of milk once a week at our house? Just things like that, or mowing the yard, or excellent.
Right, changing the air conditioner filters in the house. How often do we have to do that, but yet we just can't seem to get around to it. So yeah, those are the things that can be really helpful.
Excellent. Well, I know, and I'm so sorry, Riley, I think we might have had you on mute. Welcome back. We've had so many comments. Thank you so much for very comprehensive information, for sharing the resources that are available. Helen has reminded us that we do have an excellent handout. It's 100 things to do with someone living with dementia. And it's a list of all kinds of just little suggestions of things. And I can't tell you how many times we have sent that out, because it's full of, just little activities, things that we can do with loved ones while we are at home. And they might, at first glance, some of them can seem a little silly, but we talk with families about how they're not silly. They're things that your family member is most likely, depending upon where they are, still able to do. So we've got that as a resource as well. And again, the comments just keep coming in. Thank you so much, Russell.
Russell, this is Dianne. We also had a question on kind of how can someone encourage their loved one? I know that they're talking about maybe losing that process a little bit and seeing a little more decline in their loved one communicating verbally. So any suggestions on kind of how to encourage a little bit more of that, if that's still possible?
Sure. And that's a really common question or concern that people bring up. I think one of the frameworks for that conversation, Diane, comes to me from a resource that I found online, and it's a small booklet called Welcome to the Planet Alzheimer's. And the idea from the author is that the person living with dementia is now on a different planet. And whenever you're engaged with them, you have to remember that you are visiting them on their planet, and that their planet has different rules, and the same rules of logic and reason that are on your planet don't apply here. And so we have to really meet the client where they're at. So if they're engaged in a lot of repetitive questioning or a lot of repetitive behaviors, sometimes we have to remember we can't use logic and reason to try to talk them through that situation. That's not going to be an approach that's very helpful. And so sometimes having that shift, that ability to take my perspective and move it to understand, oh yeah, I'm on their planet and their planet doesn't have the same rules that I'm used to, can put me in a different mindset to find more creative ways to address some of those issues and behaviors. Is that helpful?
Thank you, Russell. Definitely. I know it's just such a challenge. Like you said, everybody's kind of going through it and nobody has been through it before. So the challenge of our long-term care communities wanting, everyone to be safe and healthy. And yet as family members, you also feel like we've heard that they're losing a little bit of this time, right? We're losing this time that we won't get back. So trying to engage as much as possible and in any way that they can is very, very helpful. Thank you.
You bet. Thank you. Appreciate it. And Jenny, thanks. And Riley as well. Appreciate the invitation to be on today. And if you have any other questions, feel free to reach out to me. I'd be happy to answer them.
Wonderful, Russell. Thank you very much. Such important information.